More than 400 people have been infected with the coronavirus and 9 people have died. Wuhan now has checks in place at airports, railway stations and roads out of the city. Public gatherings have also been restricted.
There was no country not affected.
We were entirely underestimating the impact and the capability of such a virus.
I don't believe that anyone expected something of this magnitude.
We knew very, very little about the disease.
We had no information on how a pandemic like this would evolve.
It hit us completely unprepared.
I remember clearly the ambulance sirens. It never stops. I've seen scenes that you'll never believe in this hospital during the pandemic.
Pandemics are an imminent and permanent threat.
And the only thing that has helped us in this very difficult time has been science.
It takes more than one person to solve a problem.
This is a very difficult disease. You cannot breathe. You feel that you are not improving. Imagine how difficult is it for people with the feeling that you may lose your life, you know?
I think at the early stages, people didn't believe that, this is going to be a pandemic, this is going to affect people in Europe, because firstly, it's never happened before. I think people also saw this as potentially, this is just another hype. This is just another thing that's gone away. I think we remember that in the early days. But the science was clear. It was coming out, this is a dangerous virus, and this is high potential to spread around the world.
It was eye-opening seeing what was happening and the scale of the problem that was starting to arise in Wuhan, and then as it spread out away from that city. I remember seeing one of the doctors from Hong Kong early in the pandemic, probably in mid-January or later January, speculating what it would be like in terms of this thing, if this thing went global. And he was talking about millions of cases, and I was awestruck that he would be talking about anything like that.
You could see already in the numbers, the infection rates, the mortality rates, it was coming over from China to Europe. And I think there was still a level of denial. So I think this period kind of lasted too long. There wasn't a fast enough response from governments. I think they just didn't believe that it was going to get that bad.
And then, of course, when we started to hear about it coming to Europe, first, I think, as I recall, in Italy, and you started to see very significant numbers. That was, of course, starting to get much more worrying in terms of closeness to home.
It arrived really around Christmas, 1st January days in northern Italy. There were connections of, for example, industry connected between northern Italy and the Wuhan clothing industry and migrant workers. So I think you can reconstruct very fastly the dramatic and awful pace it was spreading to most of the people in the world.
There was a point in mid-March 2020 where everything changed, and I think that that's what really sharpened people's focus and got people really thinking about how serious this really could be, not just in a faraway country like China, but actually here in Europe.
What we see with COVID, it has very violent disease pattern and a very easy way to hop over. Many viruses only have one of two, but COVID has both. So it's really destructive.
The challenges were huge. Basically we had a pandemic spreading at the speed of the second, let's say, across the world. We didn't know what it was. We didn't have any solutions, let's say, treatments or anything, right? But, even the very simple things, a mask, for the individual use or for the professional use, they were really, really scarce.
In the pandemic, we faced many, many challenges. One of them is the unknown. That's the worst thing for all of us. We don't know exactly how the virus is transmitted, how fast it spread. So things changes very rapidly. And the other challenge, and clearly for us, the most challenging one, is to take care of so many people so sick in a very short period of time.
The fact that healthcare services could potentially be completely overwhelmed in terms of numbers of people flocking into critical care units and needing ventilators, that was, I think, the point that got a lot of people thinking about, oh my goodness, we have to do something to address this. There was a point at the very beginning where a lot of governments were not taking this seriously. They don't have confidence in science, in scientists, and in data, and I think that's a very big problem.
I think governments were listening. I don't think they wanted to believe what they were seeing. And actually, I think that led to the initial major spikes in different countries.
When there is a new disease, the very first weeks are of paramount importance. We have to make early as possible decisions, but we don't know all the variables, all the details.
Of course, there was a lot of expert opinion that had warned for these threats, but still it hit us completely unprepared because it simply didn't have precedent in recent history in our geographies.
Many countries were quickly learning. They did steps to disrupt the spreading, like, say, put up quarantines, so keeping people in their homes. Many countries enforced wearing masks, keeping distance, washing hands, and I would say classical means.
I think it was each country to themselves in terms of crisis strategy. Some countries had more preparation than others, for sure. But in general, nobody, I think, anywhere in any country was prepared for this. And the idea of lockdown seemed so alien at the time.
Health systems in Europe are the responsibility of the member states, so there is not a single European vigilance or surveillance systems or health system at all. It's another lesson that we have to be very aware in the future.
As the pandemic progressed, we really identified very soon the different gaps that were out there, let's say from testing, in diagnostics, in data, also with protective measures, equipment at hospitals. The first very early forces that we saw were innovators trying to solve the problem. This is what an innovator does. It was the invisible hand.
Towards the end of March, we were developing 3 concrete ideas on how we would want to respond. The first one, we saw that there were so many people who said there are things that I can offer. I have great and potentially useful data sets. Others had tools to analyze those. And it went on and on like this. And this was the moment when we just established a sort of a marketplace that would just connect people across Europe to then go off and support wherever needed. The next piece was that we looked for companies that were severely affected, where we knew that they had great potential, but that they needed to weather this storm. And we also decided to give very targeted support in our, we call the rescue instrument, to make sure that those companies could fare well. And finally, we did negotiate quickly extra tranches of funding, also from the European side, and said we quickly want to utilize that in what we called rapid response projects. So we were looking for projects that could be quickly implemented in healthcare and could provide immediate relief. And we sourced those projects and put them together within less than 3 weeks.
You need to remember that EIT Health is a community of best-in-class innovators. Basically, this is a problem perfectly suited for us. Once people understand the problem, innovators just start working on that. And then what you need to do is you need to support those innovators, those entrepreneurs, give them enough of freedom, so they can solve the problem. Data is one of the biggest strengths in Europe. Okay, probably we're sitting on the biggest pile of healthcare data of real value across the world. In the early days of the pandemic, we were truly underutilizing data. We have a pile of existing data that we could use, and then we have a pile of new data that we just needed to connect.
During the pandemic, data was mostly being used by government departments to make decisions on policy on when we should lock down or not. And that was really by making projections on the infection rates in particular areas and the mortality rates. Outside of the government spheres, data was really being used to identify drugs that could be repositioned, to understand how the virus was evolving. This has been done by startups like us, but it's been done in academic departments around the world. There was a huge amount of data generated in this period. Tens of thousands of research studies were published in a very short amount of time. It's never happened before. And this data really shone a light on the biology of the disease, of the virus itself, and of treatments that could be used in a very short time frame. The problem was that there was almost too much data being generated from so many labs. I think at one point there were over 2,000 new research publications per day. It's not possible to read that many papers, and this is why we built our solution. Our platform works by mining biomedical literature, so millions of text documents and also massive amounts of databases. Then we find connections and relationships between genes, drugs, and diseases, and then we can predict which drug will match a particular disease and which patient features could fit for a particular drug. We started to use the platform to identify what potential drug targets could be associated with COVID, using research data from the SARS-1 outbreak, but also the recent research that had been coming through at the time. So very early on in February, we were able to identify drugs that could be used or repositioned for COVID. We identified hydroxychloroquine before Trump and Elon Musk started to tweet about it. And we also, very quickly after that, identified the side effects and reasons why this drug would not work in many patients. Unfortunately, that part wasn't taken on in the media, but we could see at that point that our platform could be very powerful for mining all this information coming through.
The promise of AI is that it will allow us to do things far faster, cheaper, and better.
In Europe, we've got about 500 million people. The more data, the better data analytics you can do. So if you have more data across Europe that's shared, then we can see these type of insights much more clear than if we just operate in individual smaller countries with much less data. It could have helped hospitals to identify patients at a higher risk much faster. It could have helped to identify or try different clinical trials for new treatments in those particular patient types. It could have helped to segment clinical trials and bring in new different types of clinical trials that were going on around the world in a much faster way.
Data and the application of technologies to data, new and existing data, was very important for Europe to get moving to the next stage. In the very early days, we have to remember that we knew very little about the disease.
Nobody knows why some people has COVID-19 and remains asymptomatic, and why other people has a very severe disease, needing ICU admission or having many different troubles.
I think we see an incredible transformation of our hospitals. People from very different specialties work together in order to cope with this huge amount of patients.
There is no magic bullet for COVID-19. We visit the patient, we have different phenotypes. Depending on this phenotype, you are showing me different things. You can show me that the virus is winning the battle. Other pattern may be that you are fighting with the virus and the inflammation is working against you. One of the most important things for us has been to offer a personalized treatment for all the patients. And that's the basis of the COVID-19 Control Center. We create a computer tool who allows us to follow all the patients and to detect the changes in clinical phenotypes. To say us, your patient now needs anti-inflammatory treatment. So one doctor in one screen was able to see what was happening in all the hospital and was able to pick the telephone and call all the colleagues. Your patient in the room 2 now is entering in this pattern. We were able to diminish in more than 50% the deaths of those patients who receive a personalized therapy approach. And probably more than 10,000 patients has improved thanks to the Control 19 COVID Center.
This project has shown great results initially in Barcelona, but we're scaling it to other areas in Europe, and it has provided actual help and support to clinicians and ultimately, of course, to patients.
When you can stop and think about all the things that many people has done, because this is a team effort, you feel very proud, of course.
I think the next stage of COVID was when we started to understand a little bit what it was, but then we were getting patients to hospitals, and then we were getting news all over Europe and all over the world that our hospitals couldn't cope with that.
Before the pandemic, for most of us, most Europeans, getting healthcare and being treated by doctors meant stepping actually into the doctor's office or possibly a hospital. That during COVID times was for most people not possible. Not advisable, dangerous to do.
I think it's a very difficult situation for the general population. Say, if I get ill, the hospital will not take care of me, or the primary care cannot visit me. That's a very tough situation.
It forced us, of course, into adopting now technologies that were available, but that were not implemented.
We started to do what you need to do, which is use segment. You need to see, okay, who needs, the treatment, who needs to come to the hospital, and who can be treated elsewhere, right?
Just before COVID hit Europe, we were actually with the whole team on a ski trip in Ischl. At that moment, it seemed very safe. It was our 5th anniversary, so we had a good time with the team. Nobody was thinking about COVID at that time. For us, and I think for most people, at least in Europe, it still felt something that was from far away, but wasn't really happening in Europe. That really changed very fast for us personally, because when we came back, actually everybody became sick. Luckily, nobody became really seriously ill, but yeah, we felt it right away, like this is COVID. If you look at how healthcare is structured in Europe, I think actually across the world, it's very much focused on the hospital. This has been shown with COVID, where all of a sudden you have a very acute problem, that this creates a huge bottleneck. Before the pandemic, we were working on remote monitoring and on different types of diseases. Neurological diseases like epilepsy, like MS, cardiac diseases, respiratory diseases like COPD. So we already had quite a bit of experience, but we reached out to our partners, to specialists, to key opinion leaders to check what would be useful. So we built on the experience they had and fine-tuned actually together with the hospitals. COVID Care at Home is one of our applications that we focused on helping COVID patients. In essence, it's very simple. We do what typically they do in a hospital, but we do it in a home environment. For COVID patients, there's 4 parameters that need to be measured 3 times a day: respiration rate, temperature, heart rate, and oxygen levels. We have a box that we give to patients with the devices where they can measure their parameters. And 3 times a day, they can input their parameters in the app, and that's then sent automatically to the cloud. And there we provide a dashboard for the pneumologists or the doctors that follow the patients, where they can just see what the parameters are of the patient, but also what's the status. And they calculate what is called an early warning score to check the severeness of the disease. The goal was to get to 10 hospitals, but actually in 2-3 months we got to almost 40% of Belgian hospitals. If you look at the space, and if you look at remote monitoring in general, one of the big bottlenecks is there was no payment, there was no reimbursement. We've been working directly with the policymakers to be able to adjust that reimbursement framework, to be able to allow, enable different stakeholders to be paid to monitor and follow up patients at home. The speed that we were able to work together with them was remarkable. So I'm very thankful for that as well. We started Bitefly 6 years ago with the idea of, okay, we're excited by technology and we think we can have impact on healthcare, but it's really the first time that we felt we actually have impact on patients. You make a difference.
I see lots of startups, working on the space of, home monitoring, and providing services at home, so they don't come to the hospital, because you need to keep in mind that hospitals were just, yes, they were busy, but they were also risky places in the sense of, it's where the biggest concentration of COVID was taking place.
Chez Libéraux, nous organisons la mobilisation rapide de professionnels de santé en tout lieu, pour tout type de soins, grâce à un dispositif clé en main. En tant qu'infirmière de formation, ayant exercé à l'hôpital et à domicile, j'ai pu identifier qu'il y avait une grande problématique dans la mise en relation avec des professionnels de santé, notamment à domicile, mais aussi une grande volonté de valoriser la place des infirmiers dans l'écosystème de soins en France. Avant la pandémie, notre activité était concentrée sur la santé à domicile, l'accompagnement des patients atteints de maladies chroniques. Avec la pandémie, nous avons boosté cette activité, fait des partenariats avec des laboratoires pharmaceutiques et des hôpitaux. Libéraux a été un acteur très important, et il l'est toujours, dans la gestion de la crise sanitaire Covid-19, notamment pour faciliter l'organisation de mobilisation d'infirmiers et l'accès à des professionnels de santé qui peuvent faire des tests, des soins, des vaccins.
Donc, du coup, je suis infirmière libérale. Mon travail consiste à travailler au domicile des patients. Je m'occupe à la fois des patients chroniques et ponctuels. Après, depuis le Covid, donc depuis la pandémie, je me suis essentiellement occupée de tous les soins qui sont relatifs au Covid. C'est surtout pendant la deuxième phase du Covid que j'ai ressenti une période assez stressante et très fatigante, car j'ai travaillé tous les jours pendant 5 mois, donc peu de temps à accorder à la famille. Les patients étaient à la fois stressés et très apeurés.
Mon ressenti lorsque j'ai appris que j'étais atteint par la Covid était compliqué, puisque j'avais entendu beaucoup qu'il y a des possibilités d'aggravement, on va dire, des symptômes, etc. Et je savais qu'il n'y avait pas forcément une facilité d'accès à l'hôpital, etc. pour les soins. J'ai quand même été rassuré par l'approche que j'ai pu avoir par le personnel soignant à domicile, ce qui m'a permis d'être suivi et d'avoir aussi une présence et un dialogue qui permettait de rassurer grandement.
The technologies were mostly there. I think what happened was that they were significantly increased.
Je pense que l'approche de la télémédecine, notamment par les patients, a évolué avec le Covid, d'une part parce qu'ils devaient passer par la télémédecine pour avoir accès à un professionnel de santé, mais par la suite, quand c'était plus une obligation, les patients ont trouvé un usage simple de la télémédecine pour avoir accès rapidement et facilement à un professionnel de santé.
Scientists made a significant breakthrough in the fight against the coronavirus. The vaccine now appears to be on the horizon. They expect to begin clinical trials in the coming weeks.
At the very heart of this is research. You have a problem that you've never heard of it, so you need to really do clinical research. And then 2 problems appear there. First one, of course, is, this disease took priority, so all the non-priority diseases in terms of clinical trials, they were put on hold. And the second is that there were some clinical research studies that were not able to move forward because they couldn't find enough patients, to perform that, right? And what this tells us is that we drive efficiencies in clinical trials, in clinical research, so we can respond faster.
Having cancer in a pandemic is horrible because none of the support groups, none of the kind of complementary therapies and all of those other things which support you through kind of surgery and treatment, and none of the talking groups were open. So it was really, really hard. And I just felt very isolated. I got to the point where I was so concerned about pandemic and not wanting to go into any sort of hospital or any sort of setting. Anything that wasn't urgent and immediate kind of fell by the wayside. So I do think cancer patients have been neglected, and there are probably lots of people who have cancer now where they don't know where to go and what to do.
The delays that we saw because of the pandemic, and that's having a really long-lasting effect on patients that we probably won't fully understand for years to come in terms of delayed diagnosis for cancer, delayed treatment for cancer, and other diseases as well. We originally developed Ancora for cancer, and what we saw was most oncology trials paused or stopped recruiting patients, and it took many months for new trials to start up again. That was because, of course, the patients who were participating in those trials were some of the most at-risk patients, immunocompromised, ill, and it would have been risky for them to have to go into hospital, receive treatment during the pandemic where they might be infected. If you look at the first days and weeks of the pandemic, the really stressful part was the way the virus was hitting hospitals and ICUs in particular. That's really where Ancora and where clinical research comes in, because it's the only way that we can understand how a virus like this works and the best ways to prevent it, to diagnose it, and to treat it. And clinical research is the way that we understand all of that. A lot of the way that clinical trials were being conducted before the pandemic was quite old school, requiring face-to-face patient visits, patients literally carrying their medical records from one appointment to the next. And we've seen a lot of that change and adoption of new technologies like Ancora that help to facilitate and make more efficient some of these kind of old-fashioned ways of conducting research. The Ancora AI platform is very straightforward for users. So they go to our website, answer a brief questionnaire, and then they can see all of the relevant clinical trials for the criteria that they're looking for, and then use that information in a very user-friendly way to make treatment decisions and also discuss with their physician, for example, what their options are. Everything is phrased in a very non-scientific, layman's terms. The process of finding trial results can be completed in less than 2 minutes, as opposed to hours of research that would be necessary before. And really importantly, we don't require registration or personal information to access the results because we know that privacy is a big concern among patients when they're dealing with this kind of decision-making. We launched our product, our tool for patients, in March 2020. So it was the busiest time for the company and a big moment for us at the same time that, the world was just falling apart. But we quickly adapted our solution in a number of weeks after the pandemic hit Italy because we could see what was coming. And when we launched Ancora, we also included coronavirus clinical trials from the very beginning.
Historically, clinical trials, they only happened in hospitals. Basically, if you were a subject of a clinical trial, you just need to come to the hospital, right? And I think there's great benefits in decentralizing trials. I think we will get greater numbers of people recruited. We'll get faster in results. Everybody will benefit. And I think digital technologies is the key enabler technology for that.
Our team strongly believes that access to life-saving treatment, which is often only accessible through clinical trials where the most novel and innovative medicines are at the moment, that it should not be based on luck alone or who you know or having the best doctor, but actually that should be an option available to anyone.
We've seen how data could help us and did help us in the pandemic. The war is not over on these other diseases. I think it's time for serious investment going in so we can apply the learnings that we got from the pandemic into finding new treatments faster for the right patients in other diseases.
As the epidemic progressed and as we started to learn more about this virus and about what interventions work, that's where we did start to turn the corner a little bit and started to realize there are things that we as a population could do to slow the transmission.
The initial clinical trials were starting to show that the vaccine programs were really all taking off.
We go through 3-4 months of heavy stress in the health system, and then fortunately it begins to wane a little bit.
The hygienic measures who were becoming better and better, so to say, utilized and applied, and allowing us to go back to normal life.
As more testing became available, more strategies for the kind of distancing became available, there was perspective, and I think that was good. But then also, of course, there came impatience.
At the time being, I think we are pretty much closer to be a little bit ahead, but still we have not reached the finish line at the time being.
One of the things that people forget about AI or don't know very well about AI is its predictive capabilities. It allows you to predict things that haven't happened yet. And that gives you, as a healthcare professional, a healthcare manager, gives you, great insights in what to do in moving forward and how to address the issues at hand in the most efficient way.
When we first started to hear about this pandemic is when we decided as a company and as a board that we needed to do something to really help in the fight against this pandemic. So we redeployed a good portion of our software team to focus on developing software platforms that could be used in the fight against COVID. So in the first instance, we developed a tracking platform that was tracking the number of cases, the numbers of deaths. And then we were able to hook up with Professor of Epidemiology at Imperial College, and that's where we got more into the area of data and prediction and how we could use epidemiological prediction to really help people understand what's happening and what's likely to be happening in their country over the next few weeks and months. The COVID SIM platform was being used by countries all over the world, especially lower and middle income countries, in order to understand what government interventions might be required. The government could therefore use this to implement lockdown strategies or other interventions, lockdown, social distancing, or mask wearing. Another aspect of COVID SIM that how many countries have used it is in terms of planning their rollout of their vaccine strategy. So effectively understanding which different strategies could be adopted, and you could use the platform to give some indication of what would be the ideal strategy to minimize impact, minimize deaths.
The first COVID-19 vaccine has been approved for use in the UK. It has been manufactured by Pfizer and its partner BioNTech. Trials have shown the vaccine to be 95% effective.
The moment where society started to think, well, we'll start seeing the light at the end of the tunnel was where we got the first information that some vaccines were, in the final stages and they were looking very promisingly, right?
The feeling that we had, at least myself, that works mainly on the vaccine field, when we see the first reports of the first vaccines, mRNA vaccines, that say the efficacy is 95%, this is impossible. This is the best news. I don't believe it. So I have to read through the article to see what's going on so quickly, so efficacy, so safe.
So it was incredible, and then it was incredible because it was done in different approaches.
A lot of people, over the world sharing information, putting things together, and finally they say it works and it's safe enough.
In today's intensive care stations, I think the vast majority of people unfortunately suffering there are not vaccinated people. This misconception, this numerophobic fear in not bargaining the side effects against the benefit of such vaccines has made that we are almost halfway stuck.
A new coronavirus variant is spreading across mainland Europe. Scientists warn that it shows no sign of slowing down and that it now accounts for the majority of new cases across multiple European countries.
Toward the end of last year, when we started to see the vaccines get rolled out, and there was a lot of enthusiasm and optimism that we had won and that the pandemic was over, and sadly that wasn't necessarily the case, because we then started to see the onset of the variants, and as they arose in different parts of the world.
When the variants arrived, I felt a bit of frustration, because it was another element that, of course, was very clearly and very well predicted, that this would happen, right? And it wouldn't then be clear on what the characteristics of those variants would be, and that they could potentially be worse and more infectious or so. And I felt again then frustrated, because again there was a feeling that we were not really prepared, not even really fully mentally prepared to now put the strategies in place to deal with those.
I don't think the conversation in the public sphere was really on the evolving virus. It was more about how do we stay safe from this. It was not clear for most people in the public that this could evolve.
The impact of those in terms of increasing where we thought the trajectories of the pandemic was going to be well controlled, that was starting to not be the case again in different parts of the world. So there was concern, absolutely, when we started to see the variants, and we started to realize that yes, we have these vaccines, but are the vaccines going to work against these variants?
These vaccines were designed based on the original Wuhan strain. In the meantime, there have been a number of variants identified that gave an advantage to the virus in spreading in the population and binding to the receptor in our lung cells, for instance. They are much more effective compared to the original Wuhan strain. So we cannot exclude some viruses may learn how to evade the immune response. Now, there are some attempts in which companies, including us, are modifying the vaccines they are developing in order to adapt it to the new variants. The vaccine now approved are based either on RNA, messenger RNA, viral vectors such as adenoviral vectors, or they are based on inactivated viruses. Our vaccine is based on DNA, so it's in a way similar to RNA, but DNA vaccines have a number of advantages. RNA are very delicate, so you need the cold chain. The DNA can be stored at room temperature. You can ship your vaccine all over the world. And the second is that the formulation with lipid nanoparticles is quite complex. You can modify DNA very easily and get a very specific immune response against a potential variant that may escape the immune response. The DNA technology is a cheap technology because you need bacteria. This is a vaccine platform that can be applied to any kind of disease.
I think the important piece here is how will we know what's the end to this? When is the new normal coming? And for this you need information, which is almost real-time information. Today we don't have real-time information, right? And then I think that's the next stage. If these things take longer, we'll need solutions that will offer real-time information that I can test very easily and very cheap, and then I can prove real-time that I'm fine, let's say, right? Until everything is fully eradicated.
I think that since the really beginning, it was clear that massive testing was one of the key challenges. Either you want to test if somebody have gotten the infection, or either you want to test for immunity to allow for some movement, like traveling and so on. I think at the beginning we had the necessary testing technology, but not to do it at a scale of the whole population. The labs in the healthcare providers, they were not prepared to have this massive amount of tests daily. Rapidly it was put in place several technologies to help on doing the massive testing as fast as possible. But in addition to this, then the way to communicate the test result to the population also needed the support of technology. Initially, it was done in several ways, even with some ways that were not fully, let's say, GDPR compliant, but the main objective at that time was that people knows the result of the testing. That's why in Certified Health we felt that there was a gap there, providing a system that is able to rapidly communicate the test result while being GDPR compliant. Certified Health is a system for consumers, for citizens, where they can have their own medical wallet. So any medical result, they have it in a digital form in their smartphones. So it's just a web application where they can access and see the test results. We even try to make it simpler, so the way that we communicate them the results is through a link to their email address or to their smartphone that they can follow and easily get into the system. During the COVID-19 period, that was mainly used to facilitate the access to the COVID-19 related tests. Nowadays, Certified Health is mostly being used for certifying the result of a vaccination. The major impact would be that they have in their hands all the time the medical information about them. With Certified Health, we capitalize our expertise and possibilities, and we did something for the management of the pandemic and something for the population.
To respond or contribute to the response of such a pandemic, you need to bring a lot of different capabilities, different knowledge, expertise, different organizations together, and that's what EIT Health has. Let's not forget that in all of these projects, in all of these initiatives, there is so much complex work. There's so much difficulties and challenges to master. And this has all been contributed by people who have extraordinary energy and motivation.
But we should not make the mistake that it was just the money, right? I think the key element for this was the collaboration. The top people in Europe trying to find solutions, collaborating together, without taking care of who gets the credit at the end. We didn't do that in isolation. But it was great because it was a huge collaboration between institutions at the European Union level, EIT as part of their crisis response, and EIT Health. We have a terrific network of 150 partners, and it was great to be collaborating at the different levels, with different approaches and try to find common solutions for the common good.
So the data is telling us now very clearly that the vaccines were a massive success. That the efforts, the bets that were taken early on for vaccine development really paid off.
The good news was that the first generation vaccines very quickly demonstrated that they even still cover those variants. With the tests and with smart behavior, we can almost go back to normal life.
We still don't know the timescales, and this coronavirus will be with us for many years. But at least now we have tools at our disposal that we can use to mitigate some of the worst effects of the virus.
Looking back, I think the three key takeaways of what we've learned in this pandemic. Number one is the importance of research and innovation, in solving problems and moving us forward. The second one, for both processes, which are very inefficient, collaboration is key. You need time, you need money, you need knowledge for sure. But if you collaborate, the combination of time, money, and resources, gets to better outcomes. And then the third one, in order to solve problems, we need to have data and AI and technology in general, digital. Innovation was already important in Europe before, but the reasons why it was important, it was mainly to make our healthcare system sustainable. Now I think the change is that we understand that innovation is needed for healthcare systems, which I hope it will make that the public will ask for more monies to go to research and innovation.
So many of the solutions that have been developed and that will be developed further, they are here to stay. And I think they will make our healthcare systems better. They will make them more resilient, but they will also make them better for patients. And I think this is ultimately a very positive trend and a very positive journey that has only just begun.
I'm hopeful that what we've learned during the pandemic can be transferred into other disease areas, and that public investment goes into developing data infrastructures from this. It was coming anyway. We've seen how data can help us, or could help us, and did help us in the pandemic. I think it's time for serious investment going in to sharing data so we can apply the learnings that we got from the pandemic into finding new treatments faster for the right patients in other diseases.
If we miss the opportunity of reinforce now the health system, I think we will be again positioned that every new virus that would arise, and something in the future will arise, certainly, we will be probably under the same stress. That is not acceptable for me. And hopefully we will overcome and even get stronger after we conquer or win COVID-19.
It has been good for us to be able to learn these lessons. Of course, I would have hoped that we could have learned this lesson without having to go through this terrible pandemic. But I do believe that we have learned a lot from this, and that the world, in fact, will be at a better position to address future crises.
I mean, I work in healthcare because the team of EIT Health members, I would say all of them 100%, they work here because they can see the impact that they do, right? And certainly this, this situation has given us lots of opportunities to see our impact, let's say. So to me personally, knowing that I lost people, as a result of these things, so knowing that other families will not have lost their family members, to me is great. It's the right thing to do,